Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning and welcome to the Senior Moment Show. My name is Bruce Lee. I'm here with my co-host, Sid Roeder. Good morning, Sid.
Good morning, Bruce.
It's good to be back.
It absolutely is.
Although it is cold outside.
It is cold outside.
Yeah, that's not so good. It's okay. But we can enjoy the beauty of what the changing season brings, even though part of that is cold, and neither of us really like that, but that's okay. But we'd like to welcome to our show today, Josh Fenton, who is with a company called Aegis. They're a home health and hospice here in town. He's the community outreach person. We're going to get to know Josh in just a second. But before we do that, let's talk about our sponsor, Sid.
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and efforts to provide information to seniors, their family members, and really anybody who cares. And we do so via this radio show. If you'd like to find out more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. Or lastly, if you have any suggestions for this show, you can call me personally at 435-512-6406.
Thank you for sharing that, Sid, and thank you to our sponsors who help us put the show on. We hope you find it beneficial. And actually, we're going to hit right dead on with our purpose today, which is education about different things in the community and talking about hospice. But before we get to that, let's introduce Josh. Josh, welcome.
Thank you. It's good to be here.
Glad to have you here. As I said, Josh is a community outreach person for Aegis, which is a local home health and hospice. They have offices in lots of places, but there's one here in Logan. There's one in Brigham.
Yeah, so we actually cover here in Cache Valley and Brigham City. Then we have a couple outside of the state of Utah.
Nice. Yeah. And but he's here kind of on a special assignment, which is even bigger than Aegis.
Yes.
Because November is
Hospice Month. And so we always like to reach out and just let people know what hospice is.
Awesome. Well, before we get into that, I know Sid wants to jump in here too, but Josh, tell us about yourself, how you got involved in this industry that serves people with hospice, maybe a little bit about your background.
Yeah, absolutely. It started when I was a CNA. So I actually was a CNA and did home health and hospice. This would have been decades ago, unfortunately. But it's just evolved, and now I work with Aegis, and I do community outreach. I do education. We try to work really close with doctors, families, and try to customize care. It's really what it's about.
So Josh, a lot of time when I talk to people, I get the feeling that they don't really understand what hospice means or does, and the only thing they think about is you're dying.
Oh, absolutely. And that's probably the biggest thing. There's a big myth about when you go on hospice, it's like you're giving up. But to be honest, it's all about helping individuals get the customized care that they need wherever they're at. Hospice happens in the home, at a assisted living, in a skilled nursing facility. It doesn't matter where. You can get hospice care, but it neither hastens death or prolongs. Let's be honest, we're all going to pass, right? The biggest thing is it's this event. How do you want it to happen? And so we really try to focus on not just the individual, but the family, and that's what hospice is.
So you're actually here in capacity of representing the Cache Hospice Coalition, Cache Valley Hospice Coalition.
Yeah.
Talk about that.
Absolutely. So the Cache Valley Hospice Coalition, it is a group of companies, individuals that really have the focus of taking care of the community, and that's our biggest push. It was started 18 years ago, and the purpose was to unify hospice agencies to meet and discuss different challenges, issues, needs, and successes in our community, and everything related to hospice care. We actually meet quarterly to discuss all of these things, and just recently, I love this, every November we actually have a rose ceremony at the Cache County Senior Citizen Center in Logan. And that's where individuals have the opportunity to actually take a rose in memory of their special loved ones, right? So November being the month of hospice care, we want people to remember those that have passed on. And so we have this little ceremony where you can get together.
And what's the date on that again?
That just happened. Yeah,
Oh.
so we'll be talking about it again next year, but it's usually the first part of November.
Okay.
Yeah.
Do you know why November is Hospice Month?
You know, that I don't. For me personally, I just feel that as we go into the winter season, sometimes death does happen a little bit more in the winter months. So someone probably just chose the month.
So for any of our listeners that can't imagine or haven't had any experience with hospice, how would you describe what happens?
Yeah, absolutely. Some of the things that I think is important is that you know what to look out for, right? Some of the things that you look for in an individual, and the nice thing about hospice, you're going to work with your personal physician, right? Your PCP, primary care. However, this is something that if you see an individual that they could use the help, this is something you could bring up. And I would recommend that if this is what you're looking for, bring it up, right? It's okay to talk about it. The more you talk about things, the more you know. So some of the signs to look out for is if someone has decline physically, or if it's a cognitive status that's going down despite the treatment that they're receiving, okay? This may include increased pain or even other symptoms. Maybe it's substantial weight loss or extreme fatigue, shortness of breath or weakness. You have to remember the goal is to live more comfortably and forego the often physically debilitating treatments that have been unsuccessful in curing or maybe even halting that life-threatening illness.
You know, in our business now, doing home care, I've learned a lot more about how this works, even though hospice isn't part of our particular business. But working with families and even my own misconceptions about what hospice was as I entered the industry, I just didn't understand how it worked. And as our family had gone through that experience years ago, I couldn't remember how that all worked. And I thought, hospice comes in and they just kind of take care of everything, and they're there for about a few days or maybe a week, and then that's it. It's not true at all, though, is it?
No.
Hospice could be months, years, right?
Yeah, technically, most people, there's a time allotment when they say you're probably expected to live about 6 months or less. Now, that doesn't mean if you live 6 months and 1 day that you're off hospice. It's all about the qualifications or some of those things I mentioned, right? Those red flags. As you see these different symptoms, sometimes they're associated with the last part of life. And so it's really, you're going to hear that 6-month time frame. That's a really big indicator. Yeah.
So as you said, it's always the primary physician that makes the assessment to initiate hospice, or how does that work?
Yeah, actually, it doesn't have to be that primary care physician. It can be a family member, or let's say, for example, you have an individual that they're just not wanting to go through more treatments. So they just say, you know what, I'm actually happy with where I'm at. I just want to focus on maybe more quality and take a step back. I don't want to get probed and prod anymore. You can actually start to initiate yourself.
Thank you, Josh. We're already coming up on our first break right here. Maybe for our listeners, if you want to grab a pen and paper, if you have any questions about hospice, we will have Josh mention his phone number, so you could give him a call if you care. This is the Senior Moments Show. We're going to take a short break. Please stay tuned. We'll be right back.
Hi, this is James with White Pine Funerals. We're excited to host our annual holiday concert featuring a choir and musical ensemble by Jay Richards. All are welcome to attend free of charge. We extend a special invitation to anyone who is missing a loved one this holiday season. Food donations are encouraged at the door for the Cash Food Pantry. Back-to-back performances will take place at White Pine on Thursday, December 1st at 7 p.m. and 8:30 p.m. That's Thursday, December 1st at 7 p.m. or 8:30 p.m.
White Pine Funeral Services, here when you need us most.
Did you know 10,000 baby boomers qualify for Medicare every day? Did you know that you'll start to get swamped with mail about Medicare 6 months before your 65th birthday? Did you also know it doesn't cost anything to use an insurance agent to help you navigate through all those offers? Hi, I'm Tracy Ferris with Blue Water Health Insurance. Let me help you understand all the offers you're receiving and find the plan that fits best for your situation. Call me today at 435-890-8155.
Did you know that one of the greatest threats to our quality of life is a fall? 1/3 of Americans 65 and older, and 1/2 of those over 80 will fall this year. Many will never be the same again, and some will never return to their homes. This is Bruce at Comfort Care. One of the ways we can help people stay in their home is through our free in-home fall protection survey. Let us help you identify these fall risks. Call us at 754-7676. Comfort Care, 754-7676.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG and they will take care of you.
Welcome back to the Senior Moment Show. If you're just joining us today, we are talking with Josh Fenton. He is community outreach with Aegis, who is a home health and hospice here locally. He is here representing the Cache Valley Hospice Coalition because November is Hospice Month.
Yes.
And we're learning about, we're going to learn a little bit more about the coalition. We're going to learn more about hospice and how to access it. Let's jump back into what the Cache Valley Hospice Coalition is and maybe why it exists. Can you help us with that?
Yeah, absolutely. You know, when you're taking care of a community, there's going to be things that you're going to have to strategically plan for. Example, we had an individual that was on hospice here, and they wanted to go live with their son down south, right? So what we had to do is we actually had to find another agency, one that we know, one that we trust, and then we made the referral down to where they could continue that care in a different location, which is wonderful. There are going to be times where your insurance is different, right? Usually if you're 65 and above, Medicare is going to provide this benefit, right? But there are instances where maybe it's before you're 65. Maybe a different situation happens, so there's going to be different insurances. Most insurances will carve out a benefit for hospice, but at the end of the day, we want to make sure that everybody is taken care of. So that's why we have this coalition. There are great companies here in this valley, and we want to make sure that we communicate. Like I said, we want to know what's working well for people, how we can help the residents of this valley even more, and this coalition really looks for that.
So over the break we talked, and Bruce is actually also a member of the coalition. And Bruce, do you want to talk a little bit about some of the members?
Yeah, I do. I'll list a few. I don't have a comprehensive list here, but this will just give you an idea of who some of the members in the community are. Some hospice companies, some are not hospice companies, but all are facilitating, helping people to find the right solutions with hospice.
Yeah.
Just some of note would be Sunshine Terrace, your company, Josh Aegis, Tender Care, Home Health and Hospice, CNS, Community Nursing Services, Rocky Mountain, Comfort Care, my company. Those are all companies that are members of the coalition and quite often compete, quite frankly. These companies compete with each other. Why would companies that compete come together to form a coalition?
You know, at the end of the day, it's kind of what I talked about. It's that communication. Yeah, we might compete because we're doing different things. We're in the same community. But at the end of the day, like when you really think about hospice care, I want to make sure that you're getting taken care of. It's about the service. So whether you go with one of these agencies or another, like, let's be honest, in this community, most likely a neighbor, a friend, a family member, they're going to have a tie into one of these companies. So if you're getting to that point, talk to your friends, talk to your neighbors, or any of these companies that you listed, and let's get you the help.
Yeah, I just would like to add that it's nice to work in a community where the companies do work together pretty well, and that it's about care for people and helping them to have good experiences or the best experiences they can as they themselves are going through some difficult times, or a family member is going through some difficult times and they don't know what to do. I guess along those lines, Josh, what do you think the number one reason is that people don't call a hospice company?
Boy, I really think it's because they're nervous. Maybe that nervousness is fear. Maybe they're afraid to talk about it. Maybe they're scared to mention how they're feeling, or they're just, this is something new, right? I haven't died before, and so it's really hard to just be like, oh yeah, with my experience, this is what I do. No, so what I really love about it, maybe it wasn't going to go this way, but my mother, we put her on hospice. It was a hard thing, but I remember Dad just couldn't do it all at home. And I just remember him saying, I really need some extra help. And that's when it hit. I'm like, this is what Mom needs. We don't want to talk about it. And then once we got into it and we really started to dive in, it was a different event, right? It's going to happen. It's how do you want it to happen, right?
That actually brings me to a question. I've been around an uncle who was on hospice before he passed, and I think one thing that I wasn't aware of before then is the help that you receive as a family member also in the process of passing, the things that happen, how to read them, if things are painful or not. Maybe do you want to touch on some of those? Yeah,
well, sometimes you think you're going on hospice. This is just me. It's just for me because I'm going to be passing away. It's much more than that. There's going to be emotional stress. There's going to be financial stress. There's going to be physical stress. And you know what? It's not just yours. It's those that are around you. For example, we had a gal in our community, and I've heard this many times before. Her husband passed away. He was on hospice, and she was locked out of her bank accounts. So she couldn't even get to the money that she needed because, you know what? Her husband passed. The financial institution saw that he did pass, so they didn't want fraudulent things to happen. So I completely understand, but it left her in a sticky situation. So a lot of these agencies actually work with financial companies to where they will walk you through this, and they'll call Medicare, they'll work with Social Security to ensure that you're taken care of. So yes, it isn't just about that individual. I mean, that is the focus, but it reaches to the rest of the family.
You know, you said something earlier that really sticks with me, which is, and I'll paraphrase and get it wrong so you can correct me, but something to the effect that hospice doesn't either extend life or shorten it. It's really just a way to help manage it. And the benefits that come along with hospice, when you're making that choice, and you're looking at, well, what's my life look like right now, today? How do I feel? Am I happy? Am I sad? You know, how am I dealing with things that are going on? Isn't it true, or would you say, I feel this way, better with hospice, right? I mean, you get so many things that a hospice company can deliver versus trying to wade through that yourself.
Absolutely. The phrase, you're right on, hospice neither hastens nor postpones death.
Yeah.
And when I look at it, there's a reason that we started this back in 1974. The United States initially jumped in, and Medicare jumped in a little bit later to give this benefit to individuals. And another reason is they're trying to make sure that if you're done, and when I say done, if you don't want to go get more tests because you already know what's going on with your body, this is the great chance for you to not have to go in and do that and then have to pay more money to the hospital. Hospitals are great, love hospitals, but everything has a time and a place. And so a lot of times Medicare is trying to say, hey, we're going to help this individual. If they're happy to stay at home, we want to bless them by staying at home so they don't have to do all the different tests.
Josh, as I said before, maybe we want to give you a chance to mention your phone number in case somebody would like to contact you to get some more specific information.
Yeah, absolutely. Remember, there's all these great companies that you can choose from. Go with who you feel best. But at Aegis Home Health and Hospice, you can reach us at 435-723-9000. Once again, 435-723-9000.
Thank you, Josh. This is the Senior Moments Show. Again, we are sponsored by the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. We're going to take another break. Stay tuned. We'll be right back.
Whether you have a small business, large corporation, or sole proprietorship, remember Cook Martin Polson has provided quality accounting services since 1977. At Cook Martin Polson, they believe you've earned it, and they're going to help you keep it. Take a minute right now to call 750-5566. That's 750-5566 to set up your tax appointment and let Cook Martin Polson show you how to keep the money you have earned.
This is Jared Ripplinger with Cook Martin Polson. You've worked hard for your money. Let us help you keep it.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty.
I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
Welcome back to the Senior Moment Show. If you're just joining us today, we are talking with Josh Fenton, Community Outreach with Aegis Company. It's home health and hospice here locally in the Cache Valley, Box Elder area. We're talking about Hospice Month, which is this month of November, and the Cache Hospice Coalition, of which Josh is a member. I also am a member of that, trying to serve the community and help people get all the benefits that they I wouldn't say are entitled to, but they are, but more so that would benefit them and help them to live a better life. And so hospice for sure is one of those. Let's talk about something that's maybe my least favorite topic, but I'll just jump into it anyway, which is COVID. The past 2 years of the big COVID word, and fortunately things are much better than they were, but within healthcare and hospice, I assume there was an impact with your staff, nurses, care. What did that look like?
Yeah, it was a pretty difficult time. I mean, you're used to business as usual. Everybody was used to that. And then when COVID hit, you had different processes that you had to go through. And it was tough, right? Instead of just worrying for someone, now you have to make sure that you're not transmitting anything. And then half of the time you don't even realize you might have it, right? A lot of people were vaccinated, they're getting tested, they're wearing masks, gloves, everything was added to try to make sure that we could still get out there and give care. Because remember, this is something that is in the home or assisted living or skilled nursing facility, and those facilities were shut down. Family members couldn't even go in there and see loved ones, and it was a difficult time. And it wasn't because of the facility, it just everybody was trying to figure out what this virus was, right? Something new to us. Yeah.
So maybe let's talk a little bit, because you mentioned before in the break too about the hospice team, and you did want to give some thanks there.
Oh, that's wonderful, Sid. Yeah, I want to give it just a huge shout out. We have nurses, we have aides, volunteer coordinators, and volunteers themselves, chaplains, social workers, etc., office staff. I just want to give a big thanks to those that make a difference, right? You can make a difference in a lot of jobs, but, these are the real heroes that are out there day in and day out, especially during COVID. So
yeah, I want to echo that, because that is just, we watched our staff go through some difficult challenges as they work with families that were dealing with that, as they dealt with it themselves. I know the community at large, the service community that were out providing services, hospice workers, it was such a difficult time. It's not completely over, but it's much better, but still impact from that.
Absolutely.
With people. Yeah. What else have you got there for us, Josh?
We were kind of talking about how hospice just isn't for the individual. It's also for the family members and those that are, closest to that individual. So some of the things, there's other benefits that are part of hospice that, not only we're trying to make sure that there's pain management and symptom management, which is very difficult, But we also have support services for families, right? We have them for the patients. We have a bereavement for families. So 13 months following the death of a loved one, we want to make sure that you have that chance to grieve. I wish I could say that everybody's going to grieve this way or that way, but it's different for everybody. So we want to make sure that you have that chance to go through it your own way, right? We also have a chance if someone, let's say a patient needs extra help, or maybe the family caregiver needs a break, hospice can actually help give a respite care. This is where you're going to get up to 5 days, where we're going to take that individual, help take them into a place where we have more nurses, more staff, and sometimes that caregiver needs that break. I've had several individuals close to me on hospice, and there is a thing called caregiver burnout. And in this coalition, there are other companies that help with this burnout that can give extra help, like yours.
Yeah. That is a big issue. Coming back to hospice, I wanted to mention a book you've probably heard of. You ever heard of the book Being Mortal?
I have.
Yeah, that's written by an author, Atul Gawande, I believe is how you say it. He was actually a surgeon, and his dad got sick and passed away. Mm-hmm. If you are out there and you want to read something that will help you understand the purpose of hospice and kind of what happens in the medical field, this book, Being Mortal, is an excellent book about the process of why hospice is there, how it helps families deal with the process of passing and quality of life. And I'm just going to say really quick, one of the things the book brings up is, how do I know what to do? When should I do more for my loved one? And there was a woman in there, and she said, well, I asked my dad, what made life worthwhile, and he said, if I can watch the NFL and eat ice cream, I'm good. I want to be okay. So when he had troubles, she went to the doctor and said, can you watch the NFL and eat ice cream? And that helped her to deal with that process. And there's things in there that are like that. So
one thing I might add, just at the very last, I think the biggest thing or the worst thing that could happen is that you have questions, you have concerns, you have that thought, and you don't ask someone about it, right? Reach out. There are answers. There are people here to help. And that would be my biggest push. Just ask someone.
Thank you, Josh. And thanks for coming in. Maybe you just want to mention your phone number one more time before we end our show.
Absolutely. With Aegis, it is 435-723-9000. Once again, 435-723-9000.
Thank you, Josh. Thanks for coming in. This is the Senior Moment Show. Again, our sponsor is the Empowering Seniors Group. If you'd like to find out more about them, you can do so online at empoweringseniors.info. We're at the end of our show, but we hope you tune in again next week.